Ask Science Armor Series. I'm Karestan Conan, a licensed clinical psychologist, author, and professor at Harvard, where my lab focuses on research and training around trauma and mental health both in the US and globally. Armor about childhood trauma and the effect it can have on our mental health. Over the past 20 years, I have conducted research on trauma globally. My work has focused on the following questions. 1. Why, when people experience similar traumatic events, do some struggle while others appear resilient? 2. How do traumatic events get under the skin and cause physical and mental health problems? 3. What can science tell us about how to help people recover from traumatic events and thrive? Today, I have partnered with Numbers Story to raise awareness around the role of childhood trauma and adverse childhood experiences, ACEs, and their long-term effects on mental and physical health. Excited to answer any questions you may have. My goal is for you to leave filled with hope and equipped with healing strategies for yourself and loved ones. I will be starting at 1 p.m. Eastern Time, 17 UT, Armor. Links, plus learn more about my work at Harvard here. https://www.hsph.harvard.edu/Karestan-Conan/ plus learn more about ACEs, childhood trauma, and healing strategies here. https://numberstory.org/ plus check out Number Story's video on ACEs here. https://www.youtube.com/watch:mark v=5 plus link to my most recent book here, Treating Survivors of Childhood Abuse and Interpersonal Trauma, Stare Narrative Therapy. https://www.amazon.com/treating-survivors childhood interpersonal trauma DP 1462543286, DP 1462463,543,286, ref equals DP_ob_title_BK. Plus learn about population mental health here. https://www.hsph.harvard.edu/population-mental-health Population Mental Health Forum Series, plus link to my other writing here, plus https://community.thriveglobal.com/author/Karestan Conan, plus https://community.thriveglobal.com/author/Karestan Conan, plus https://www.psychologytoday.com/us/blog/mental-health around the world, plus resources for people struggling with trauma and mental health, plus https://afsp.org/suicide-prevention- resources, plus https://www.samhsa.gov/find-help/national-helpline, plus https://www.rain.org/resources username Dr. Karestan Conan edit, also answering, plus Christy Denkler, professor at Harvard, Kadenkler, plus Sarah Maricos, executive director of ARN, Sarah_Arn, plus Joy Thomas, Director of Communications ARN, Joy Rises, plus Elizabeth Holloway, ARN, Elizabeth_ARN23.
Which are the most common childhood traumas and effects of it? How to prevent our kids from suffering from it?
What are your thoughts on psychoactive drugs, psilocybin and MDMA, being used in therapy settings?
Why is narcissism so prevalent these days? Why is there no help for trauma from a narcissistic parent? Why is the dynamic of having a golden child and whipping boy so prevalent in the modern family?
What do you think about the term trauma becoming overused? I'm glad it's becoming normalized, but it seems the pendulum has swung too far into a place where trauma is losing its meaning. Thoughts?
Can anyone fully recover, heal from childhood trauma where it no longer impacts their day-to-day life, relationships and experiences?
Can trauma and other ACEs be linked to neurodivergent conditions like ADHD, and if so, what causes this?
What kinds of therapies are most effective for people wanting to function better despite trauma?
Can traumas get inherited through empathy? If one person really tries to understand what a traumatized one goes through for a long period of time.
What are your feelings towards EMDR therapy? Is it really useful to essentially relive the trauma to move past it?
Is it possible for an event to occur that is traumatic for one individual as opposed to not being traumatic to another? And if so, what causes this?
Is 65+ years old too late to recover from childhood trauma? If left untreated, does it get worse with age, and is there a higher risk of developing an age-related mental disorder? Apologies if the terms here aren't used correctly.
Is it true that children who are exposed to prolonged trauma develop brains that are physiologically different than their peers?
How bad is spanking?
The first question you mentioned above regarding resilience is particularly interesting. I think, for instance, about kids who grew up in similar circumstances, in the same home, even, yet one might develop healthier, more resilient patterns whereas another does not. A. What factors contribute to, or predict, development of resilience? B. Can institutions like schools help kids, with or without high ACEs, develop resilience? If so, how?
Not sure if this is an okay questions or not, but if I wanted to have your job in 10 years, what should I be doing now?
My speciality is fibromyalgia and my research focuses on the correlation of trauma and the development of fibro. What are your thoughts regarding trauma and the incidence of chronic pain disorders?
It is absolutely possible to recover from the most painful aspects of childhood trauma where it no longer negatively impairs your ability to function in your life and relationships. However, our traumatic experiences are always a part of us. I like to think of our lives as a quilt. Some patches are pretty, some downright scary, however together they make something beautiful that can nurture us. So part of recovery is integrating our traumatic experiences so they are one patch on a quilt and not the whole. A more scientific note, there is growing evidence that if we attend to and treat the mental health consequences of trauma, we will reduce the likelihood of the physical health consequences down the road. For example, we have shown that if you reduce people's PTSD symptoms, you reduce their risk of heart disease, and other people have shown this too. So one of the best things that a trauma survivors can do is attend to their mental health, and that will have a big payoff in terms of their physical. EMDR is one of the therapies shown to be effective for PTSD in clinical trials. For people with PTSD after trauma, which is characterized by things like not being able to stop thinking about the trauma, nightmares, feeling on guard all the time, difficulty concentrating and sleeping, and avoiding things that remind you of the trauma, trauma-focused therapies are very helpful. There are quite a few different ones, and some use writing, some use reliving. Link above provides descriptions and evidence for different ones. Great question. There is more and more evidence that trauma impacts children's brain development. More specifically, the type of trauma matters. My colleague Kate McLaughlin has done a lot of work showing, for example, that threat-related traumas such as physical abuse, abuse impact the brain differently than loss-related traumas. But that is not the whole story, as there is also evidence that the brain remains plastic much later in life than we thought, and that intervention can help. I saw a presentation yesterday which showed changes related to trauma were reversible. So there is a lot of reason to feel hopeful. A link below for some reading, and look up anything by Kate. Link above provides the information on different treatments for people with trauma and their evidence base. The go-to treatment for people experiencing PTSD after trauma are trauma-focused cognitive behavioral therapies. These usually involve some kind of revisiting the trauma, sometimes through reliving it and sometimes through writing, etc. These have proven very effective for trauma recovering. It is never too late to recover from childhood trauma. When I worked at the VA hospital years ago, I ran a group for elderly female veterans who were in recovery from trauma, often in their childhoods, and saw amazing progress. In fact, when we are older, we bring a wealth of life experience and wisdom to our recovery that can be helpful. More scientifically, there is more and more evidence that if you address the mental health effects of childhood trauma, whether PTSD or complex PTSD or depression, you can offset the long-term physical health effects. That is, Taking care of your mental health will have downstream positive consequences for your physical health. Here are some papers recently published on this. It's a very exciting area and argues for putting more resources into mental health. Also doing things like exercise, yoga, mediation, or even just activities that bring you joy and connection regularly can have big long-term benefits, even small changes. One of my teachers used the analogy of a sailboat. You move the rudder a tiny bit right now and in the long run you will end up in a completely different place. A good overview of the different types of events. Sadly, most children will have experienced at least one trauma before the age of 18. Which are most common really depends a lot on context, as the answer differs for boys and girls. For example, violence and childhood abuse is common, but with COVID so is bereavement, and accidents are common. Are many different kinds of trauma, so it can feel overwhelming to talk about prevention as it depends on the type of trauma. However, there are things we can do. For example, violence is a common trauma that is responsible for a large mental health burden, so any intervention that reduces violence can help. Legislation that reduces car accidents by reducing driving or raising the teen driving age also reduces trauma, as it reduces the number of kids who experience accidents. As you can see, you asked a big question. The other way to support kids is after the trauma, to make if kids have experienced trauma they get the help they need. In some cases this may be medical and mental health treatment, but it also means making sure they are safe, making sure they have their basic needs met for food, clothing and shelter, and have adults they can rely on talk to about what has happened. Not all kids need medical or mental health intervention, but all need to feel safe and loved. This is the question that has occupied me for most of my career. It's an important question because many people do well after a trauma, and we want to focus resources on people who are at high risk of not doing well. If you take any mass trauma, for example, I worked in NYC after the September 11th terrorist attacks, and even if you look at people who were at ground zero, some developed PTSD and some did not. Why? I am putting an article in below. But briefly, things that matter include the person's history before the trauma. Let's take assault as an adult as an example. Someone is more likely to do worse if they previously had childhood trauma or had a mental health condition before the assault, so life history factors influence response. We also do work on genetics, that is, there is a genetic vulnerability to developing PTSD after a trauma. Then, even given the same trauma, certain details influence how people respond. For example, it's more damaging to be assaulted by someone you knew and trusted. Then factors after the trauma influence response. How did people react when you told them? Were you supported? Did you have physical injuries to deal with? Did the trauma result in other negative changes in your life? Like, did you have to leave your job or friends or home? Great question. I could spend days on this one. Links. This is a very promising area of research. I am glad it's being studied. The challenge is, however, that it's hard to do a true randomized controlled trial on psychedelics. That is because it's hard to have a placebo control. People who are on the drug know they are on the drug, and if you are not, you know you are not. This can indicate all kinds of bias into the results. The research is therefore in the early stages still at this point. They seems useful as an adjunct to other kinds of therapy. One of the arguments is they make the brain more plastic and more susceptible to intervention. Along these lines, something that is getting more attention is breathwork that induces psychedelic states. Like this is really interesting, as it was first explored by folks who did early psychedelic research and then had to adapt when psychedelics became illegal. Breathwork is appealing because it keeps the person doing it in control of their experience, rather than being under the control of a substance, and also it could be used by people who can't take drugs for medical reasons. There are many articles on this, so just indicating a